Not yet. May I please have a motion? Thank you. Now we have discussion. Mark, please.
Thank you, Mark Alcott, past president. I rise not to advocate for or against this proposal, but to express some concerns. The linchpin of this proposal is the certification by 2 physicians that the patient will die within 6 months. That assumes a level of certainty which, as far as I know, I'm not an expert, the medical and scientific community has not reached. We all know of instances where patients outlive their anticipated expiration date and have some quality of life going beyond that. Indeed, where people recover from what has been diagnosed as a quote-unquote terminal illness. So that's one concern. And the second is that there's the centerpiece of this is an assumption of freedom of choice by the patient. I worry about pressure being applied by family members, by hospitals, by the medical community, or frankly by the individual himself or herself. You know what, it's time for me to go, give me that pill or whatever it is. So I express this as concerns, and yet I very much understand the important objectives that you're addressing here. And so I note that you've done a lot of research, that many states already have these provisions. And has there been research on the question of abuse, of certainty, uncertainty, and so on? And are the results sufficient to give you confidence that this proposal, if adopted, would not be abused? And then finally, who is going to administer? I mean, you have a very complex scheme here. Who is going to administer getting the, the 2 doctors, making sure the patient has not been coerced? There's a whole list of criteria. Is every hospital going to have an aid in dying supervisor? Thank you.
Well, thank you so much for those very helpful comments, and I'll try to address them one by one. Certainly, we're all aware of prognostication uncertainty. This is not something new. And I do believe that given the way the statute has been developed and with the safeguards, that we would not anticipate any problem in that regard. In terms of all the research we did on the other jurisdictions, there are no reports whatsoever of coercion or abuse, and we did hear from a number of people on this very question. In terms of how the bill would be implemented, if enacted, of course, implementation is always a challenge. And I would like to turn to President Lewis, who has said a number of times that one of our goals here is to have a seat at the table. And we look forward, if the bill is enacted and you folks approve our report and recommendations today, we would look forward to having such a seat at the table and being able to work with the legislators and all of the healthcare providers and professionals to make sure that the bill is meaningfully and safely implemented.
Chair recognizes Hermes Fernandez. Hermes.
Good afternoon. Hermes Fernandez, a delegate from the 3rd District, former chair of the Health Law Section. The work of the task force is tremendous. The hearing from the various experts, the report itself, all tremendous. As, by the way, I want to say what we've seen today in all the reports that we've seen, great talent, great dedication from everyone from the Bar Association. Everyone is to be commended. But I am wholly uncomfortable with the State Bar Association endorsing a bill, supporting a bill that at its core is about suicide. We can call it medical aid in dying, as the sponsors now call it. Medical aid in dying is really palliative care. That's really hospice care. What this bill is about is medical aid to die. And I think that is something we should have some hesitancy about. This is not an idea that has swept the nation. Since Oregon in 1994, there's only 11 states that have adopted assisted suicide legislation. I'm concerned about what that means in terms of the dignity of life. I'm concerned about what that means in terms of how our ends of days are perceived. There will be suffering. I realize that the proponents of this are very concerned about relief from suffering, a concern we all share, something most of us will face. But I remain concerned about how we begin to change the question about how our ends of days will be faced. I am concerned about how, not coercion, not even pressure, but how persuasion will occur for those whose lives are less valued. And we can recognize those individuals now. There are individuals with less money. There are individuals whose lives have been filled with disabilities. And when we are talking about end of life, we are talking about all of us at a time we are vulnerable, at a time when we have less abilities, at a time when we become very concerned about the impacts of our deaths on our families, the impact of our time as our family members are spending with us in those days. I think this is something, while it has been deeply looked at, and the report is an excellent report, and the recommendations that would go along with this position are extremely important and useful and should happen. I am bothered by the underlying point here that what we are talking about is suicide. It's not something I think this Bar Association should support. Thank you.
Thank you, Hermes. Chair
Well, sorry.
Yes, please.
Well, I want to thank you, Hermes, for so clearly articulating those concerns. And I will say, on behalf of myself, I certainly share them. I think every member of the task force certainly shared these concerns. And let me just say more globally that I think that we're all aware that we have a healthcare system in the United States that has failed us. We do not have universal health care. We have serious inequities and disparities in access to care. And we spent a good deal of time in the report talking about social determinants of health, which you folks, of course, know all about. So I think that some of the issues that you're addressing are really systemic issues that I agree, and I think my task force members would join me in agreeing, will not be solved, and certainly will not be solved in the context of this law either. I also want to commend you for sharing your values on this issue. This is certainly a value-laden project and discussion, so I think we need to be aware of that. I'm not quite certain how to respond to your comments about this being suicide. I think there has been a change in understanding about that, but I certainly respect your opinion and your framing of the problem, and thank you. Thank you so much, Hermes.
The chair recognizes Michael Markowitz.
Michael Markowitz, Vice President, 10th Judicial District. Yesterday, when we were talking about this, I asked the question, and I think I'm going to ask it again, so maybe you can explain it. And the question was, why is there no judicial oversight here? Why can't we have something where there's an order to show cause and done in an expedited fashion with a petition, so you have somebody who is objective instead of subjective, like the doctors, like the patient, making a decision as to whether or not there should be essentially assisted suicide or assisted end of life. So if you could answer that, I think that would be helpful.
Well, Mary Beth, if you wish to, but you did answer this question yesterday, I believe.
All right.
But I'll leave that up to you.
Well, I just thank you for the question, and I do think, as I mentioned, we have a history of palliative care, hospice, and end-of-life care in New York State. I don't think that the structure that you're recommending is needed in this particular case of this bill that is before the state legislature. I will bring to your attention once again that we have very well-crafted recommendations in the report to address additional safeguards for certain special populations who may be at risk. So thank you very much.
Please identify yourself, sir.
Jonah Treebwasser from the Criminal Justice Section. I had the horrific misfortune of watching two people I know die from Lou Gehrig's disease, where active, brilliant minds were trapped in frozen bodies. And I visited them as often as I could. One was a family friend, one was a professional colleague of ours. And the terror in their eyes, not the fear of dying, but the fear of continuing to live in a frozen body, made an impression upon me that I will remember all the rest of my days. We wouldn't treat a beloved pet like this. We'd put that pet out of suffering. If one of our loved ones or ourselves has a terminal cancer, especially another person I knew had brain cancer, was writhing in agony right to the last minute, or Lou Gehrig's disease, we would want blessed relief for them. I stand here in support of the report. Thank you.
Thank you, sir.
Thank you. Thank you very much.
The chair recognizes Fern Finkel.
Fern Finkel, Chair of the Elder Law Special Needs Section. We are fully in support of the of MAID, and we want a seat at the table when it comes to the New York State Bar Association should have a seat at the table when we support this legislation to be able to work together on the regulations. Nobody should have to go to Switzerland or to another state. No one should have to leave the comfort of their own home or community, their loved ones, or have to transport people with them in order to do this. This is not something that can be done lightly. This is something that needs to be self-administered. As the last speaker said, in referencing pets, why do we put our beloved pets down? Because we love them. But this doesn't allow us, and we want them to be out of suffering. This does not allow us to put anyone down or to end anyone's life but our own, with very, very stringent requirements. Fully in support. Thank you.
Thank you, Fern. The chair recognizes with much pleasure Kathleen Sweet, our president-elect designee.
Good afternoon. I had the honor and pleasure to serve as the liaison from the executive committee to the task force. I was assigned to this and failed at the time of my assignment to recognize just how personal my own experience was. And until you have been in the presence of one of your dearest loved ones who are in desperate agony and anguish for which you can do nothing, you cannot understand how important our support of this bill is. Many of us in this room will be the ones that have the terminal disease. And if this bill does not pass, New Yorkers, hundreds, thousands of New Yorkers will be consigned to excruciating, hopeless anguish at the end of their lives. I watched my mother go through that type of death. She was not a lawyer. She thought that because I was her health care proxy, that I could make a decision for her and help her expedite her death. Obviously, I could not. And I think that this bill will provide autonomy to New Yorkers who find themselves in an untenable situation. One of the things that we learned in the context of our research is that at least half, and maybe even more than half, of the people who avail themselves of medical aid in dying in these other jurisdictions wind up not using it. It is the sense of autonomy that they have from having the option, knowing that in the event that their pain overwhelms them, that they can self-ingest this medication. We heard stories from families who experienced their loved one's death the way I experienced my mother's death. And we also heard joyful stories of families in other jurisdictions, as close as New Jersey, in Vermont, when their loved one decided that it was time to ingest the medication, they gathered their loved ones around them, expressed their love to everyone that came to see them, and it allowed for them to move on or transition, or whatever the word is that is consistent with your belief system, to accept the end when the end was inevitable. This is not suicide. This is not someone who is depressed. This is not someone who has some other mental disability. These are people who have decision-making capacity and ought to be allowed to have access to this medication and to this option. Thank you.
Thank you,
Thank you,
Kathleen.
Kathleen.
There having been a motion and a second, please have a vote. All those in favor, please indicate by saying aye. Aye. Any opposed, please indicate by saying nay. Any abstentions? We have an online vote. The report passes. Thank you very much, Mary Beth.
Thank you. Thank you, everyone.